I'm very excited to teach you the Kipling's approach. This is a wonderful and mind-blowing approach. I actually came across this approach accidentally. I was reading some journal or article, and I found that journalists, police officers, and investigators use this approach when they're actually investigating a case. And I was very fascinated by that. And I thought, why can't we use this for history taking, or why can't we use this when we are dealing with an OSCE scenario? And I got amazing results when I used this for the OSCEs. Let me explain what it is. So the approach consists of 5 questions: who, what, where, when, and how. So I'm going to explain this in great detail with an example. Let's think that our patient is 5-year-old boy Lucas, who is there on the screen, who has a fever and is vomiting. They've given some additional history that he is fully immunized. He has no significant past history. Your tasks are to take focused history, perform focused examination, and manage Lucas. So let's apply the Kipling strategy to this particular scenario. So let's go step by step. So when you actually stand outside the room, these are the 5 questions you have to ask yourself. First, who is your patient? Okay, in this case, it's Lucas, who is a 5-year-old boy. And the reason why this is important is, when you ask the question who, if the patient age group is in extremes of age, for example, like a child or an elderly patient, you have to be very careful. That's a red flag. I usually treat such cases as a red flag because these are the age groups that can, become sick very ill. So I will be very careful whenever I see extremes of ages like a child or elderly. I'm very careful. So then we will go to what. So what is his presenting symptom? So fever and vomiting. Excellent. Good. Now we will go to where. So where is more about the location where you are practicing. Some scenarios that will not be given, so don't worry. So where is more like, what is your location? What is your practicing location? Where are you practicing? Is it like a hospital situation, or is it like a general practice or a clinic or surgery? Is it like a rural location, or is it an urban or semi-urban? See, all these things have got a great significance, because if it's in hospital, you have all the specialists available straight away. You can do the CT scans, MRIs, and everything straight away. If you are in a clinic or general practice or a surgery, you may have to refer this patient to hospital in case if there is any deterioration, and you don't have many investigations or imaging facilities available. If the scenario says it's a rural location, then everything will change, because the nearest hospital can be 500 to 700 kilometers from where this rural location is, and there are very minimal facilities, like there may not be a X-ray machine available, or there may be no CT scan, or there may be no MRI at all in the rural location. And when you're referring this patient to hospital, you have to think about air ambulance, not the ambulance by road, because if it is 500 or 700 kilometers from the rural location, if the tertiary hospital is that far, by the time the patient reaches the hospital, he is dead if it's a emergency. So you have to think about the air ambulance, and that's the reason this where is important. Okay, and next we will go to when. When is something you ask yourself. Again, this might not be given in the scenario, but you have to ask yourself, when you go to this scenario, you should ask, okay, when did he start getting all these things? Okay, so fever and vomiting, so that's not given. So one, you have to ask the patient, once you go inside the room, about the duration. Okay, the last part of the approach is how. So when you ask this question, you have to ask yourself, how am I going to deal with this patient? It's very easy. So all you need to do is move on to the next approach, which is the routine and red flag approach. Once you use these two approaches, you almost know what the diagnosis is. So just listen to the next video and I'm going to teach you what is red flag and routine approach.